Hi, I'm Gary Chimes from Lake Washington Sports and Spine, and we want to talk about one of the regenerative medicine products that we use called lipogems. Sometimes these are called orthobiologics, and the idea behind this is using your own body in order to create healing factors that you then concentrate and place into the joint. So the idea behind this is sometimes called a micro-fat transplant process, where we take fat off of your body, usually from the abdomen. A lot of people don't really mind having some fat taken off their abdomen, and then you micronize it so that you have different cellular constituents that come out of the fat, which we then extract and then put into an area. So I want to show you two separate cases involving the knee to give you a little bit of a sense of exactly what we're dealing with. So what we have here on the screen is an MRI on a patient's knee, and what we're looking at, let's first look at the knee model, is that you have the femur, the tibia, and the patella. So this is going to be the area behind the patellofemoral joint. So it's a subtype of patellofemoral syndrome, and the hard cartilage at the end of the femur, the thigh bone, is called hyaline cartilage. And this patient had a focal cartilage defect. So if we look here on the MRI, we can see this gray area, and then that white spot is going to be a localized area of cartilage defect. So historically, we thought this is something you really couldn't treat through an injection. You can maybe give some pain relief. But what we're finding is that we put in the lipogems, and I'll show you what's involved in that in a moment. But we can actually see the next day, we saw that the fat graft actually went right into the joint, and it filled into the space. And this is really wonderful. We find that compared to some of the other products like platelet-rich plasma, which we love, this actually, the lipogems, has a stickiness to it that gives better potential for cartilage regrowth. What I'm going to now show you is a follow-up MRI, and we actually see that the cartilage regrew. So if you remember from the initial picture, there was a white defect that went all the way through. So this is actually regrown cartilage. So this is a real game changer for us. So let me actually show you what the lipogems process produces. This is some leftover lipogems that we have from a procedure we did earlier today. So the patient was kind enough to allow us to show you, and it looks somewhat like a lemon curd. So as it comes out, and it has a stickiness to it. And let's show on an ultrasound what's actually involved here. So we're looking at a patient's ultrasound. So to orient, so that's an important point. We always use ultrasound. We know a lot of people in the community do regenerative medicine, but one of the really important things is if you're taking the time and money in order to have a procedure like this performed, it's really important that things are actually going into the joint. So if we look here, what we're looking at is lateral or outside of the knee, superficial, so this is me skin and some fat. This is me the quadriceps tendon, and this black space is me the joint space. And you can see the needle going in, and then we can see the fat layering perfectly into the joint space. So we're using this for a patient for knee osteoarthritis, potentially as a surgery-sparing procedure to minimize the chance that this patient would need a knee replacement. So we just think this is a wonderful tool to have into our armamentarium. So the product's called lipogems, the practice is called Lake Washington Sports and Spine, and I'm Gary Chimes, along with my partner, Gary Hyman.